Well, throughout the pandemic, ABC15 has delivered in-depth reporting, and for months, our Cameron Polam has used his expertise to bring us stories within our community. So let's continue our town hall this morning, the special town hall on the vaccine. Cameron joining us live this morning. Good morning to you, Cameron. First question for you this morning. Hector writes to us. He says, I live in a household with 8 people, and my mother and father believe vaccines are dangerous. What would you say to people like my parents? What do you think?
Yeah, these are complicated conversations, right? So you obviously have two different generations and they have different beliefs around vaccinations. However, what we can point to is what we saw in the Navajo Nation. You were there yourself, Nick. A lot of those folks up there live in congregated settings. So they live amongst other relatives in close proximity. What we found with the coronavirus is that those types of living situations are extremely vulnerable to contracting and passing and transmitting the virus between those family members, and especially those who are older within those family members and within those family groups are extremely susceptible to the potential deadly effects of the coronavirus. So we know that this vaccine is proving to be very safe. We know it's proving to be very effective. So I would have those conversations surrounding, how safe we're seeing that this vaccine is, the pros and cons of getting it versus not getting it. We know what the cons are, and that is your life right now. If you're living in this setting, it's highly recommended by most physicians that you receive this vaccine. Obviously, I would also advise that they talk to their primary care physician, Nick.
Sure, absolutely. But as you mentioned, the more people in your house, it's just more opportunities for that virus to come into your environment. I want to get to another question. Stephen from Scottsdale asked this morning, while the requirement to provide proof of having had the vaccine may help people resume to some sense of normalcy in their lives, do we risk discriminating against fellow citizens who refuse to get the vaccine due to personal beliefs or any other type of reason, maybe some sort of medical exemption? What do you think about that?
Well, Nick, vaccines have been around for a long time. Obviously, we eliminated polio with a vaccine. This vaccine, COVID-19 vaccine, is not mandatory right now. However, employers do have the right to mandate that for their workers. Now, most employers do have exemptions, like for religious beliefs, or if you have medical problems with certain vaccines, then you can normally get an exemption from your employer. As far as making people feel isolated because they didn't get it, well, you're given this choice right now. We're not saying you have to get it. I think the majority of medical professionals today are saying that they are recommending that you get it because it's a better option than what we're seeing play out in our communities with people getting very, very sick and ending up in our ICUs. So I think if you talk to the majority of medical people, obviously you have the right to not take this vaccine. But what they're suggesting for your own health and the health of everyone around you is that you do take this vaccine.
Yeah, and Cameron, you brought up a very good point earlier. Very simple. Talk to your doctor about it, too. If you have any specific concerns about you, somebody in your house, have that conversation with your doctor because he or she will know best when it comes to your health. Cameron Polam, you have just done an awesome job, as well as the rest of our ABC15, on taking action and getting answers throughout this entire pandemic. So I want to thank you for all your hard work.
My pleasure, Nick. Thanks for having me.
Cameron, thank you. Take care.